Assalamu alaikum wa rahmatullah. Welcome viewer. Today I want to discuss about nasogastric tube in brief. Nasogastric tube it is the essential part of any CP patient who are unable to swallow or deglutition. A different type of nasogastric tube in different color. Nasogastric tube via the nasal passage is a common procedure that provides access to the stomach for diagnostic and therapeutic purpose. Medically, nutrition, medicine, cerebral palsy, spastic quadriplegia, muscular dystrophy, different syndromic baby, patient who are unable to swallow and deglutition. Diagnostic indication for nasogastric tube, evaluation of upper gastrointestinal bleeding, presence or volume of food, aspiration of gastric fluid content, identification of esophagus, and stomach on the chest radiograph. Administration radiographic contrast to the gastrointestinal tract, identification of cancer cell, study of patient with gastric cancer, gastric lavage, cytology sample collected via nasogastric tube, inserted preoperatively, were examined for the presence gastric lavage of cancer cell associated with the poor overall survival and progression. Gastric decompression, including the maintenance on decompressed state after the endotracheal intubation, often via oropharynx. Relief of symptom, bowel rest, setting a small bowel obstruction, an application gastric contained recent ingestion of toxic material, administration of medication, feeding, bowel irrigation, NG tube can be kept for corrosive ingestion for the development of tract of the esophagus, subsequently can be used for balloon dilatation. Absolutely contraindication for NG tube, severe mid-phase trauma, recently nasal surgery. Relative contraindication, coagulation abnormality, esophageal varices, but NG tube can be used for lower grade varices or stricture. Recently bending of esophageal varices, anastomosis of the esophagus and stomach. Blind NG tube insertion has traditionally been contraindicated in certain procedures involving the anastomosis because fear of damage of stable line. Alkaline injection, the tube may be kept in injury not severe. Nasogastric tube insertion for pediatric patient, correct tube size need and viscous lidocaine 2% oral analgesic spray and syringe for confirmation of the nasogastric tube, glass water with a straw, water-based lubricant, tape, emesis plastic bag, wall suction. This is the nasogastric tube insertion requirement. The use of viscous lidocaine. The snip and swallow method was found to significantly reduce the pain and gagging sensation. Alternative technique, the nebulization lidocaine 1% or 4% through the face mask. Anesthetic spray that contain benzocaine, tetracaine. Positioning of the nasogastric tube, which is the essential part for success of nasogastric tube. And patient explain what is the benefit, risk, complication, need measurement how much the tube will introduce, and verify the proper placement of the NG tube by ausculting the rush of air over the stomach using 60 ml syringe. Capnography, colorimetric capnography is another valid method for verifying NG tube positioning. During insertion, nasogastric tube may be in correct position should be identified. It may go through the lungs. Direct laryngoscopy or video laryngoscopy can aid the placing of NG tube in sedated patient. pH enzyme bilirubin carbon dioxide test also can be used. Complication of the NG tube is discomfort, generous lubrication, the use of topical anesthetic, the gentle technique, the throat irritation, epistaxis if a roughly tube entered. This is the complication of the pneumothorax can be if the tube is at recurrent placement, nasal ulceration, poor tube placement, wrong placement, food sticking, increase the pharyngeal secretion, feed failure, esophageal reflux, aspiration, pneumonia, poor body immune. This is the complication of nasogastric tube. This is nasogastric tube folding on the end. Thank you very much for watching. Please subscribe, share who loved you for well-being of mankind. Thank you.